About my background, I qualified about 12 years ago. I've worked in musculoskeletal, which is anything to do with muscles, joints, that type of thing. And I've been working with patients with hypermobility. I work with respiratory, Parkinson's. So I've got quite a broad background, which is fantastic working with this group of people. So I just want to talk about what physio can actually do. So first of all, what I've found is that support and reassurance and advice, because a lot of patients that come to see me are nervous, they don't know what information is out there, they want some advice, they want some support, and of course Dr. Gupta is fantastic for doing that, all of his Facebook pages, etc., offering lots of support, reassurance and advice. But also a word that's been mentioned today as well is empowering. That's a really important and strong word with patients managing any condition. It's empowering you to manage your symptoms, yeah? To try and take control of how you are and how your treatment goes ahead. So you're in control. So we're going to do a little bit of thing today. So I'm just going to talk through respiratory physiotherapy. So we touched on breathing a little bit. Breathing techniques, are you breathing correctly? So some of you may have been to a yoga class, Pilates class, or mindfulness, and we've talked about breathing. So I'm just going to do a little bit of an exercise today. So I'd like you all to just, we'll talk about breathing. If you don't breathe properly, it causes tension, anxiety, and stress. So actually breathing correctly can increase our sense of well-being. Now, there's different types of breathing, so such as chest breathing. So if we're doing exercise, we can breathe quite heavily. If we're anxious, if we have an emergency situation, that type of thing. There's also abdominal breathing, which is very important, and that's what we're going to do just now. So I'd like you to all close your eyes and relax, separate your legs, okay? And I'd like you to sit in a nice straight position. Okay, so you're sitting comfortably, all right? So close your eyes and just roll your shoulders up, back and down. That's it. Up, back and down. So just feel that tension in the shoulders, relaxing. Yeah. Okay, and listen to your breathing. How are you breathing? Close your eyes. Okay. Now place one hand on your chest and one hand on your abdomen. Yeah, that is just below your rib cage there, and that is where your diaphragm is, and that's what helps us breathe. So what you're going to do is you're going to breathe in, and as you breathe in, allow the abdomen to rise. So you'll feel your hand pushing away, and as you breathe out, allow it to flatten. Nice, slow, deep movement. So again, as you breathe in, allow the abdomen to rise. And then as you exhale, allow that to flatten. Okay. Let's just do that for a few more breath cycles. That's it. Nice, relaxed breathing. Listen to your breath. Okay. Good. Now everyone open their eyes. Yeah. How did that all feel? I mean, that was literally a minute or so what we did there. Abdominal breathing is very, very good for relaxing, reducing stress, and also allowing our body to breathe properly. I won't go too much into respiratory physiotherapy because there's lots more to it, but abdominal breathing is a very, very good tool to use, and spending 5 to 15 minutes per day doing that in a quiet room would be very, very beneficial for lots of reasons. Yeah. So exercise. What I'm going to talk about today a little bit is, so this is related to POTS in particular. But of course exercise, I'm a physio, exercise is fantastic for many, many different reasons. So the Levine protocol, some of you may have heard about that. Has anyone heard of the Levine protocol? No. So it's a protocol specifically for POTS, and it's a graded cardiovascular and resistance training exercise program. Okay. So I've actually got a copy of it with me today, and if anyone would like to see a copy, I'm happy to email that to you as well. So what it involves is you would do 3 to 5 days of cardiovascular exercise and then a couple of days of resistance training, and every week it would be made harder. we take your heart rate, your resting heart rate, and average that out to work out your heart rate and what level you should be working at. So as I say, this is very specific for POTS. So the Levine protocol is very, very good. I've used it on quite a few patients now with fantastic results. It doesn't work for everyone, and it's a bit of a recipe. No patient is the same. So patients may have POTS, but they also might have ME, or they might have this, they might have that. So patients can be quite complex. So it's really down to the physio to look at what you can do, what your abilities are, what you can and can't do, and develop a recipe that's right for you. So it's very, very prescriptive. Yeah. Pilates is a very, very good exercise to do, especially with POTS, because most of it, some exercise, you do mat work, so you're lying flat, and patients with POTS need that because their tolerance levels, upon standing, obviously they become symptomatic or even sitting. Pilates is fantastic for many other conditions as well. I'm a Pilates instructor, so I adore Pilates. Also, physio can help with management of musculoskeletal issues, so especially if you're hypermobile, we can use things like kinesiology tape. I don't know if any of you have heard of kinesiology tape. Yeah, very, very good for any injuries. We can advise on pacing, pain management, lots of different techniques. I heard acupuncture earlier on. I use acupuncture and dry needling for releasing tight muscles, for reducing pain. We can handle subluxations, and basically the key thing is that we restore function. We have a look at you, we see what's going wrong, whether that's your breathing, whether that's the hypermobility, whether it's the POTS, and we restore that function. And we come up with a special recipe to kind of work on those target areas. And of course, because I work very closely to Dr. Gupta, I feed back to him of all these different patients and what's going on there. So how do I do it? What's the process? So has anyone been to see a physio before? Yeah, okay. So I tend to spend about an hour on an initial assessment because I like to go into everything, yeah. So I look at subjective assessment, so that is just basically talking, finding out all about you, all your past diseases, all your problems, you know, any sort of anxiety, medical history, medications, social history, what exercise you're currently doing, that type of thing. And then I take a look at you. Yeah, so physios would expect you, if you ever went for an assessment, to come in sort of t-shirt or vest and a pair of shorts, or strip off down to your bra, so we can take a good look at you. Yeah, and there's many reasons for that. So we need to have a look at the symmetry of your shoulders, say, your hips, because we're all out of, you know, you can kind of have one hip down here, can cause knee problems, etc. So we take a good look at you. Take a good look at your joints, assess your heart rate, your pain, your function, your strength, your breathing. So do a real good MOT to find out what's wrong with you, basically. And then we do some treatment. So as I say, treatment is very, very prescriptive, very unique. I have sometimes patients that say to me, well, what are you going to do before I've actually assessed them? I don't know, because until I actually see that patient and what they can manage, what they can do, I don't know. So not one person is the same. It's like a recipe. And for ongoing treatment, it depends on you. So that may be that you'd need to see a physio once a week or once a month, or maybe Skype if you live out of the area, that type of thing. And as I say, I'm talking specifically about POTS here. That is the purpose of this presentation. So just some take-home advice. Exercise is key, but it needs to be gradual, graded and appropriate to you. You also should not start exercise, especially if you are symptomatic with POTS, etc., without consulting someone first. Yeah, so they can look at your heart rate, or if you are hypermobile, what you should and shouldn't be doing. Yeah, so we can just make sure that it's all safe. Of course, ensuring enough fluid, sodium, correct breathing. This does affect a lot of people. Relaxation techniques, mindfulness, breathing, that type of thing, reducing anxiety. and ensuring that you have a support network as well. I mean, there's lots of groups online that you can, lots of Facebook, you know, Gupta, etc. But trying to form that support network, family, friends, you know, talk to people, open up to people about how you're feeling. And remember, with everything, with every medical condition, not just POTS, not just hypermobility, you are unique. So never ever compare yourself to others, especially if you're starting some sort of exercise program and you become quite frustrated that you're not doing as well as what your mate's doing. You started together. Never compare yourself to others. We're all very, very unique. So there you go. Very short and sweet. So thank you.